Welcome to Face, our interview feature of the day. Today we are observing World Psoriasis Day 2025, Psoriasis Day, and this year's theme is psoriatic disease and comorbidities, understanding the domino effect. So we'll be learning more about this condition, how it affects not just the skin, but a person's overall health and well-being, right? So yeah, joining me today are Sofia, Lovi, Ramasamy, the president of Psoriasis Association of Malaysia, and Dr. Moonyza, Akmal, a consultant dermatologist at Hospital Kuala Lumpur, or what better known as HKL. Thank you both for joining me today.
Thank you for having us, Anna.
If you don't mind, could you move closer to the microphone, ladies? Thank you so much. Okay. Let's start with the basics, yeah. Doctor, for those who may not be familiar, could you briefly explain what psoriasis is, what causes it, and maybe clear up some of the common misconceptions people have?
Okay, when we talk about psoriasis, it's actually one of the chronic inflammatory skin disease. Okay, when we say chronic, it means like something that is having some flares and then some remission. And why does this happen is because the skin, they tend to renew faster than normal people.
Oh,
For example, in normal people, the skin will grow and shed within 1 month. But in psoriasis, within few days. That's the reason why they would have these lesions that are red, very thick and very scaly. And this happen around certain areas, usually on the scalp, at the back of the ear, the elbows, the knees. So these are the common sites where they have this skin lesion. But psoriasis can occur anywhere in the skin.
I see. Interesting, right? So that's something many people don't realize as well, right? It's often misunderstood as just a normal skin condition, but it's like much more than that, right?
Yes,
Now, go on.
The misconception is that something that happens on your skin, it can be washed off or it can be infectious, but that's actually a no-no. That's a very not true statement because it's an autoimmune disease because of the immune system. It affects the inflammatory response. So that's the reason why these people have it. Of course, when we say about inflammatory response, there are other influence factors as well. For example, genetic factors. Genetic factors. If your parents have it, you'll be at higher risk of getting psoriasis. Environmental factors as well. Stress. Stress, Sofia. Stress. Psoriasis can be induced by stress. And this stress will make the psoriasis worse, and when the psoriasis gets worse, the stress gets worse because you have something on your skin that's not supposed to be there. So it's like a vicious cycle.
I mean, I can relate that a bit to how pimples and acne work, right? The more stressed you are, the pimples and acne start showing up on your face, and it's quite similar.
It's similar in all skin conditions, skin inflammatory diseases. So in psoriasis, basically genetics, your stress factor, and infections. Sometimes some certain medications. That's the reason why you need to, what are the treatment that you are taking so that it doesn't worsen your psoariasis.
Can I just add one more question to that? Is because I've never known someone who has it. I've never been, I've never had the chance to talk to them or anything about that, right? But is it like, eczema? I know about eczema because my mom has eczema, my sister has eczema. A lot of people I know has eczema, and eczema is one of the things is it's very itchy.
Yes.
Right?
True.
How about psoriasis?
If it's not itchy, it's not eczema.
Right?
So it's like an equation like that. But psoriasis, no.
Okay.
Not all patients would have itch.
Okay.
But itch is one of the manifestation.
Okay.
When you have redness, it means it's inflamed. Sometimes it gets itchy. Sometimes not. Sometimes painful as well. And it's become thick. So the condition of itch is not a must. But the lesion itself, if you look at it, is well demarcated. You can see the margins. If I have a picture here to show to the audience actually. So they are like very thick, very scaly. These are psoriasis. And
we could see the picture, right? If you want, you can watch us on Facebook Live at TRAXXfm Official, and as well on TikTok Live as well. So you can catch the pictures and of course our lovely ladies today, right? Now, Sofia, on the patient support side, right? Your association works closely with people living with psoriasis, right? So could you tell us more about your association and what its role in supporting psoriasis patients?
Okay, The Psoriasis Association of Malaysia, also being called as PAM, is a non-profit organization which led by mostly by the patients themselves because they understand better living with the condition, how difficult it can be. At the same time, they have this vision and mission and also passion, bringing the change to the community or the society.
Yeah.
So of course, on top of that, with this number of volunteers that we have, we are actually running quite a number of programs. Like for example, the three main things that we always emphasize on is education, support, and advocacy.
Wow. Okay.
Yeah. So we are, like I said, we are the national leading organization, and we work closely with the Ministry of Health.
Okay.
Like for example, we have Dr. Moonyza, Dr. Azura, who is our medical advisor.
Okay.
And of course, we have Dr. Thiru, who is the advisor as well. So with that, we work with the patients at the same time with the government sectors and policymakers, pharmaceuticals companies, so on and so forth. Yeah.
So how long has been PAM has been around?
Oh, we have been since 1985.
Wow, that's
Yeah.
what 38.
38.
Yeah.
Correct. Yeah. So in the past we used to run not too many activities because number of people are less.
Yeah.
And as we grow over the time, we have more people coming forward to be our volunteers because I
Yes.
think we already started to create the awareness already. Yeah. So I think that's very important that we are being seen and being heard at this moment. Yeah.
And that's really great that you guys are there for these patients, right?
Yes.
And it's crazy to think that they started it in the first place.
Yes,
Yeah.
yes.
So I think when you put the patient first, you get to see their side of the story. It's, what we call it, their POV, point of view,
Yeah,
right? How they experience it.
Yes.
And as doctors and as an association, you are able to help them
Yes.
because they can share their challenges and
Correct.
what they face and what not,
Yes,
right?
yes. We have this concept called "no one left behind." Yeah, because everyone is important here.
Yeah.
I think it's also important to give them the encouragement and support.
Yeah.
Like for example, for instance, for me, I have a very good support system, which is my family.
Yeah.
And I also believe that there's so many people are suffering alone or kill
Yes.
themselves for some reason. I mean, of course, obviously this reason, but they don't have a support system to lift them up.
Yeah.
To lead their life just like anyone else.
Yeah. So I think that of course the support system is important as well, but we'll get to that point, the support
Yes.
system, right? Now, let's talk about the treatment of it, right? The medical side, doctor. What are the current treatment options available and how much have things improved in recent years?
Okay, we have so many options of treatment nowadays. Okay, of course, in skin, number one is always topical treatment.
Yeah.
As that has been our mainstay treatment. Topical means something that you
You
apply on the
apply,
skin
yes.
over that area only.
Yep.
That's supposed to be on those patients who have mild or limited
Okay.
lesions. Okay, so this topical treatment, they consist of steroids or vitamin D, salicylic acid, Infecta.
Yeah.
Okay, these are the medication that we use commonly in our clinic settings. However, in those patients who have moderate to severe disease, they would need something else besides the topical treatment. For example, we have phototherapy. It's a light therapy,
yeah.
where we go to the hospital where we have phototherapy machine 2 to 3 times a week for about 30 sessions for one course.
Okay.
That's phototherapy. It helps to modulate your immune system, thus improving your psoriasis. We also have systemic treatment. Systemic treatment is something that you take orally.
Yeah, like a medication.
Medication like your methotrexate, acitretin,
Yeah.
cyclosporine. However, this medicine, although some patients would respond well, they come with side effect profiles as well.
Yeah.
So we need to regularly monitor these patients while on that medication.
Yeah.
Okay, and in this advanced stage, we have biologic treatment. So this is, I would say, a game changer.
Okay.
Okay, why? It's because this is a very advanced medication that specifically target the immune part where it is responsible for the inflammatory factor for psoriasis.
Okay.
So if the patient responds to this kind of treatment, if they get this biologic treatment, I would say 90%, 100% clearance. Some people would have no lesions at all while on this biologic therapy.
Okay.
And this is very, 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 very good.
Yeah.
Yeah.
And it helps in the improvement of quality of life.
Yeah,
Not
yeah.
just the skin, but also the other factors such
Yep.
as your mental health, other comorbidities.
Yes.
So this is a very good option. if only the cost
Yes,
of the limit.
the cost and whatnot, right? And I mean, it's encouraging to know that there are so many effective treatments out there now, right? And then I think I wanna, but of course, for many patients, the big question is how do they actually get access to these kind of options, right? I think that's how PAM, things like the association comes into place. But you know what? Let's talk about that after this small break with my guest today, Sofia Lovi Ramasamy, the president of Psoriasis Association of Malaysia, and Dr. Moonyza Akmal, a consultant dermatologist at Hospital Kuala Lumpur, on the topic World Psoriasis Day. Don't go anywhere. Back to Face. You're with me, Anna. Joining me today in the studio, Sofia Lovi Ramasamy, the president of Psoriasis Association of Malaysia, and Dr. Moonyza Akmal, a consultant dermatologist at Hospital Kuala Lumpur, on the topic World Psoriasis Day 2025 with the theme Psoriatic Disease and Comorbidities, Understanding the Domino Effect. Now, before the break, we heard from Dr. Moonyza about how far psoriasis treatments have come, right? Now, let's talk about the support system. Sophia, could you tell us a bit more about the kind of support PAM provides for both patients and their loved ones?
We do plenty of activities like every year, especially post-COVID. We started really like actively organizing many activities, not only for the patients, for the families and also the caregivers as well. Right? For example, we do organize every year annual general meeting. Of course, for the association, you must have this, AGM. At the same time, we will also like run other talks, for example, emphasizing on psoriasis, psoriatic arthritis, or we also talk about the comorbidities as well, which we will cover that area later on. So these are the talks. Why talks are important? Because they need to know what is happening within them. That's very important.
Awareness, right?
Awareness, correct. Sometimes people think that or it's just a skin lesion. What is that? Probably like nothing, bitten by insects, or probably sensitive to some external factors. That could be the reason, and just trying to be ignorant and just apply some cream and move on. But that's not it is, right? So that's why awareness is important. And because like what Dr. Moonyza mentioned, that psoriasis not only affecting the skin, but it's also affecting the mental health. Hence, we have actually come up with a mental health pillar not too long ago, and also working closely with Moonyza as well. So when it comes to the mental health activities, we do, like, for example, yoga. It's like very light stretching, breath work, and then we did art and craft recently, and then we also did like mind kind of a games actually, like how to de-stress yourself when you're doing, for example, art and craft. When you start painting or on your canvas, you feel very distressed, right? Like you feel like you are into it. So those kind of moments are very important, and like giving them a break. So that's how we are actually trying to help these patients. And also, most importantly, this, like I mentioned earlier, awareness campaign also, kind of bridge the understanding between the healthcare, professionals, providers, families, and also patients. Like I said earlier, we also are the voice of, for the patients. We are speaking on behalf of the patients.
Correct.
Because not everyone willing to talk, or not everyone willing to advocate. So we are the voice for the voiceless. So that's how we do, from then until now.
That's so wonderful to hear, right? It really shows how holistic support makes such a difference, right? From medical care to like emotional well-being, like you said, right?
Yes.
And that actually ties perfectly with this year's World Psoriasis Day theme, right? Psoriatic disease and comorbidities, understanding the domino effect. Now, doctor, how important is early diagnosis and consistent treatment in preventing or managing those comorbidities?
Oh, that is very, very important. Because when we have some sort of abnormality, we would ask the patients to come and seek for treatment early. Because if we have been diagnosed with psoriasis, it's not just a psoriatic, it's not just a skin disease. This psoriasis can also affect the joints. For example, you have as Sofia would have now, it's part of psoriasis, but we call this as psoriatic arthritis. So the psoriasis affects the joint, where patient would have stiffness, they would have pain, swelling, and in the end it will become deformed. So we want to avoid this to happen.
Definitely.
So if you treat early, hopefully this can we can what do you call that, stop this from progressing. Not just arthritis actually. Psoriasis is also linked to a lot of metabolic metabolic syndrome, such as obesity, hypertension, diabetes, fatty liver. So these are the problems that can arise together with psoriasis. That's the reason why we need the patient to be on treatment, to do regular exercise, healthy dieting, and also mental health
support, that's very important as well, right? When you were talking about these things, how you get all these other illness together with psoriasis, it reminds me of someone having diabetes, right? Diabetes is known, right? Once you get diabetes, your organs will start like giving problems, your kidneys, your livers, and the list goes on, right? And you have to always be like on your toes and know, like, if you're having a problem, you have to go to the doctor, you have to get it checked. So now I understand that that's the same with psoriasis, right?
Because it's an inflammatory problem.
So
it's not just the skin that is being affected. Other systems as well. That's the reason why you need to follow up.
Because even now when I think about it, when our skin is on our outer layer of our body, right? So when you think about it, it's on my body, it's not going to affect inside.
I don't
know. I feel like a lot of people, I'm not sure it's just me, but I feel like a lot of people would think that same way, right? It's not going to affect
people. They think, it's just skin, not to worry much. But actually the skin, the inflammatory process it happens inside.
From
as
the
well.
inside, right?
Yes.
Actually, funny enough, it starts from the inside
Inside.
and it goes
Yeah.
outwards, right?
Yeah.
It's like that's science. That's how our body works, right? When it comes to this
Yeah.
thing. Thank you, doctor, for putting that into perspective, right? Now, for from your side, from Pam's side, right? When you hear about this theme, what does it mean to you personally, and how is the association using it to raise awareness this year?
You see, I would like to emphasize this particular, matter where many policymakers are actually unaware about the psoriatic disease, including like psoriasis and psoriatic arthritis. So, if follow the average, like based on estimation, 2 to 3% of the country's population, which is equivalent to 300 million or so, might have diagnosed or might have psoriasis. Actually,
Okay.
that's the number that we are looking at. But based on the registry, we only have about 8,000 over patients who have registered. In the based on the registry, Malaysian registry. Yeah. So what happened to the rest of them? So that is actually like a lot of them are either still hiding or probably they are not aware what's happening.
Yeah.
So it's not only happening in the rural area, probably even in the urban area as well,
Yeah.
right? So I think so basically they need to understand this is not merely skin and joint condition. It goes beyond, and it's also a lifelong systemic condition and a serious social consequences that we are looking at. So yet at the same time in Malaysia they are still undertreated, misdiagnosed. Even if you are diagnosed, whether the treatment is effective or not, or whether it is the right diagnosis or not, is still actually unclear. Yeah, because a lot of people, a lot of doctors, they are not dermatologists. They are not, like, everyone is not derm. you know. And we have also limited resources in the country. We have like barely how many doctors? Less than 200 dermatologists, in the country, and you have about 300,000, estimated population. But we are only talking about psoriasis, and we still have like how many hundreds of skin conditions.
Yeah, I understand.
So that's a struggle. So when these kind of issues are still surfacing, when one aspect of health is affected, so everything else will tumble actually. Right, because domino is not a game. But if you think it's a game, yes, it is a serious game actually. So one aspect of life is affected, then it will just drop. And that's why we have to stop the domino effect before it's getting too late, or it's too late to even be treated.
Correct.
So like for example, for myself, like Dr. Moonyza mentioned, I have psoriasis initially, and now I have psoriatic arthritis. On top of that, I have fibromyalgia syndrome as well. So if let's say earlier, treatment, effective of the treatment has been
retrospectively looking at, right?
Exactly. So if now when I look back and think back, right, oh my God, how I wish 30 years ago I have this kind of treatment in place. And I wouldn't have suffered with this limitation when it comes to mobility. It's difficulty to drive, sometimes, so many unforeseen circumstances have happened.
I mean, thank you so much for sharing your story as well together with them, right? It's really encouraging to know. And yes, I think, in today's day and age, I feel like more attention should be put into like the treatment of it, the early detection of it, and of course ultimately the awareness of it, right? I think that's why you guys are here today, highlighting this as well, right? And thank you, Sofia, for sharing that aspect and all. You know what? We're gonna take a quick little break, and then we'll talk about the mental health side of things, which is very important, and how lifestyle changes can make a difference, right? So I'm speaking to Sofia Lovi Ramasamy, the president of Psoriasis Association of Malaysia, and Dr. Moonyza Akmal, a consultant dermatologist at Hospital Kuala Lumpur, on the topic World Psoriasis Day 2025. We'll be back right after this. Face to Face on Tracks Midday Buzz with me, Anna, with my guest today, Sofia Lovi Ramasamy, the president of Psoriasis Association of Malaysia, and Dr. Moonyza Akmal, a consultant dermatologist at Hospital Kuala Lumpur. Welcome back, ladies.
Thank you.
Now, we've been talking about World Psoriasis Day 2025 with the theme Psoriatic Disease and Comorbidities, Understanding the Domino Effect. So during the break, we had a look at our TikTok live, and there was a comment, doctor, and I believe you'll be able to answer this. Maybe Sofia can add to that as well. So YK35 asks, if you have psoriasis, what type of food you need to avoid?
Okay, first we have to understand that psoriasis is not an allergic condition.
Okay.
So it's an inflammatory skin disease. There's no particular food that we advise patient to avoid. However, it depends on individual. So if a patient has certain food that makes the skin more irritable, more itch, more redness, then it is advisable to avoid it.
Avoid it, yeah.
How do you feel, Sofia?
Yeah, I
do you
feel
avoid
the same.
it?
Yeah, because it's very subjective on a case-to-case basis. Assuming that if I eat something today and the next 20 minutes or 1 hour or probably the next day, if I see any rashes or it's inflamed, then I think probably that is the possibility, the cause of the trigger.
Okay.
So then I will just stop.
Yeah.
So it's very hard because I think most of the time it's just that how you observe yourself. Actually.
Yeah. It really is a person-to-person
Yes.
basis. Like it
Yeah.
differs, right?
Yeah, correct.
Yeah. Now, doctor, before the break, I said we should touch on mental health, right?
Okay.
So yeah, how big of a role do mental health and lifestyle play in helping patients manage their conditions day to day?
Oh, it's extremely important because if you have psoriasis, especially in those areas where people can see, for
Yeah.
example, on the face, on the scalp, on the hands, people, if you want to shake your friend's hand and there's skin lesion on that area, so they'll be like not taking up your hand.
Yes,
So
yes.
it makes the patient feel poor self-esteem,
Yeah.
embarrassed. We have patients who doesn't want to go to school because of that. These are very stigmatizing.
Yeah.
Okay, so basically, psoriasis is not, as I told you, it's not just happen and occur on the skin. It also affects the mental health.
Yeah.
So this can cause stress and
Yeah.
triggers to the psoriasis
Yeah.
patients.
Yeah.
Right, Sophia?
It is like a domino effect then.
Yeah, it is a domino effect.
You get stressed and then it gets worse. Oh my goodness. Like
Yeah,
how
exactly.
maybe Sophia, you can add on that for someone who has experienced this and whatnot. How do you handle these things?
Oh my God, it's really hard to explain. I can give you I can tell you a story. Like this was happened 10 years ago, where social stigma exists.
Yeah.
It will never change overnight.
Yeah.
And so what happened when people have a misconception about your skin disease, especially they
Yeah.
think psoriasis is contagious.
Yeah.
They don't even dare to stand next to you.
Yeah.
People will avoid you in the public places. And then, like for example, for me, some motorcyclists, by the roadside, call me by names, AIDS, when they see me with
no.
full lesions on the body. So, and then, of course, I felt very devastated because I'm already battling with my own condition day to day, and now with the public's perception about me, it's totally like bring me down entirely. My self-esteem, like she said, my confidence level. I cave myself most of the time. I don't like to interact with people. No social settings. I think this has also impacted me emotionally.
Yeah.
It's really terrible because according to the statistic, every 5 patients, at least 1 or 2 will go through anxiety, stress, and depression as well. So when they are going through that kind of situation, so it's very hard to bring them back actually.
Yeah.
So I think the education wise, the awareness is so important.
Yeah.
And people cannot be ignorant. Even if you
Yes.
don't understand what this disease, you can always ask, or you don't say anything.
Yeah, definitely.
Just
right.
yeah.
Yeah, don't say anything.
You don't have
Yeah, I think that's the best
something nice?
approach because
Yeah.
you try to be nice with people because you don't know what they're going through end of the day.
Yeah,
Really,
exactly. Thank you for sharing that. I can't imagine what was it like for you, right, to go through all of that, right?
Yeah, so like for example, let's talk about the workplace.
Yeah.
People think that when you are unwell, probably your productivity, of course, it will go down. But somehow you still have to give them an opportunity to show, because while we are having these kind of issues, but we still have our own skills, abilities and knowledge as well.
Exactly.
We are not lesser than anyone else. We still can work within our capabilities and capacity. So why not give a chance and see? Don't look at externalization, that is transient, right? So look at what we have within us. So give a chance to those patients. Don't avoid them. That's not nice to do.
That is definitely not nice to do, right? I mean, you totally opened up my world today, because I didn't know anything about psoriasis. So today the both of you really enlightened me, and I believe our listeners also learned a lot of things, right? And I think like the stigma is because so many of us are not aware of it, and maybe think like, oh, berjangkit ke, it's going to come to me or something, right?
Contagious or not contagious. And sometimes if they just happen on the scalp, they will think, oh, this is just plain dandruff.
Correct. So like people like to assume things, and then listening to all the doctors that actually giving advices. That is really not nice. Get your facts right. You do your own. You go down and get do a little bit of investigation on yourself. It's an independent investigation of truth that will makes a lot of difference.
Definitely. Now we reached the end of our interview today. So of course, before we wrap things up, I want to ask the both of you something for our listeners who might be newly diagnosed or struggling right now. What's one message you like to leave with? We'll start with you, doctor.
Okay, if you have psoriasis, it's best for you to go to a certified dermatologist for proper treatment. First of all, it must be a proper diagnosis, and then the proper treatment, and then proper follow-up, because there are advances in medicine that can prevent complications and make your skin clear.
Definitely. Thank you, doctor. Now what about Sofia?
I think a couple of things. If you're being diagnosed or you have I mean, it's definitely a devastating news, but I think most importantly, you read up about the what is the psoriasis. Get some awareness for yourself first. Try to understand what happens to your body and things like that. I mean, definitely you'll be sad. I won't ask you to don't cry. Don't be sad. No, go through the phase. Go through that. Follow the flow, and then you will pick up eventually. At the same time, use your voice to bring the change, not only for you, for the people around you.
Definitely, right?
And the last but not least, so since yesterday was the World Psoriasis Day, Pam will be having a public event on 1st of November.
Oh, this Saturday?
Yes, this Saturday. Everyone is open to public. We have a lot of activities like virtual reality, some educational stuff, exhibitions, games for children. So it's going to happen again at Sunway Velocity Mall from 2 to 5 on 1st November, Saturday. Patients, whether you have a caregiver, family, friends, the loved ones, bring them over, learn about this, create awareness not only for you, for your loved ones. So education is so important.
Yeah, definitely.
It's so powerful that you can not only help you, but it can help the rest of the world.
Yes, that's right.
But also I would like to thank also TRAXXfm for giving me this opportunity, and also take this opportunity to thank all our volunteers with Psoriasis Association Malaysia, from Eugene, who is our past president, and then we have 10 of us, the secretary Patrina, if I can just name them very quickly: Patrina, Kendrick, Arif, Vanilla, Madam Kamala, Dr. Raul. Okay, who else do I have? I just want to thank all of them actually. Oh, Dr. Kita, I mean, how can I forget her, who's handling mental health? So I think, come to us. We do have socials, Facebook and Instagram. We do have emails, website. We have everything for you guys. Just come and be with us. Because oftentimes one of the biggest challenges is we organize activities. They don't turn up. I don't blame them. This is purely because of social stigma. They don't want to appear in public.
I understand.
So just try to come up and just say hi, lead your life, guys. Life is beautiful. You have more to discover.
Correct. I mean, I feel like it's like it comes down to if you're going to be shy about it, embarrassed about it, it's not going to do you any good, right? You have to own it up. You have to make yourself feel better.
Correct. Take your time. Take your time. Then when you're ready, you come out.
Yes, that's right. And now there is a community also, right? So you don't feel like you're alone in this. There's people journeying this together with you as well.
We have 60 million psoriatic patients around the world.
Wow.
And we have 60 members because we are part of the IFA, International Federation Association as well. So we have every country's commemorating the Psoriasis Day. And people are really, countries like Philippines, Taiwan, China, like all the, neighbor countries, they're just like commemorating the day. Everybody is just joyful, celebrating their life. That's very important, I think.
Yeah, most definitely. So the event is happening this Saturday, 1st of November. Around what time is that?
2 to 5.
2 to 5 p.m. at Sunway Velocity Mall. So yeah, if you are someone who's struggling, or if you want to find out more information just for knowledge per se and whatnot, go ahead and show them some support. And of course, your social media is Psoriasis of Malaysia, right?
That's right. Psoriasis Association of Malaysia.
Psoriasis Association of Malaysia. Yeah, go ahead, look them up, find all the info that you need to. Thank you so much for today, Dr. Moonyza and Sofia, for joining and enlightening us for all these insights, experience, and the encouragement, right? So yeah, we are at the end of our interview today. I was speaking to Sofia Lovi Ramasamy, the president of Psoriasis Association of Malaysia, and Dr. Moonyza Akmal, a consultant dermatologist at Hospital Kuala Lumpur, on the topic World Psoriasis Day 2025. So yeah, let's all do our part to create more awareness, empathy, and support for those living with psoriasis, right? So we got the news at the top of the hour with, I don't know with who. And then for now, I'm going to leave this song dedicated to strength, healing, and confidence, because everyone deserves to feel comfortable in their own skin.
All right.